Hello and welcome. We're talking to Dr. Gary Linn. Gary, please share something about yourself and how you became a member of the Tennessee Partners of the Americas.
Good afternoon. I'm Gary Linn. I'm a medical sociologist based in Nashville, Tennessee. I'm a longtime member of the Tennessee Partners and Partners of the Americas. I joined in the mid-1980s. And in a sense, I was selected to join Partners by a faculty member at Peabody College here in Nashville, Dr. Bob Newbrough. Bob knew, that I was both an ex-Peace Corps volunteer and that I spoke Spanish and that I had an interest in mental health and prevention research. And he was also aware that the Tennessee Partners, rather the Venezuela Partners, were interested in finding someone to come to Venezuela, to Caracas and Maracaibo, and talk about drug and alcohol abuse prevention. So in a sense, I was selected for that role and invited to join Partners at that time.
So how did your first partner-sponsored trip to Venezuela evolve?
Well, it was an interesting developmental process. Not only did Professor Newbrough select me and ask me to join Partners, but he also later on introduced me to Isabel Gouverneur, who at the time was a leader of the Partners in Caracas. And she told me that she was very interested in having someone like myself come down to Caracas and do a series of seminars in Maracaibo and then again in Caracas at the what they call Parque Central, where the government has many offices, and speak to people at the policy level and the implementation level about drug and alcohol abuse prevention. So we had some initial discussions. She went back to Venezuela. Months passed, several months, many months, and I got a letter of invitation to come and do the seminars. However, that whole period of developing the seminars in my first trip actually lasted over 2 years because they had to coordinate with the government of Venezuela and the state government in Maracaibo, in Zulia, to receive me and to set up the seminars and coordinate with different agencies. So finally, after 2 years, I had the opportunity to go down, and it was a wonderful introductory trip to Partners. I had an initial trial run of my talks and my seminars in Maracaibo. I was very warmly received. I met people at the University of Zulia and several private universities. I had a large audience and really enjoyed presenting. And then I flew to Caracas and went to the offices at Parque Central. It's a large, towering skyscraper in the center of Caracas, and I began a week-long series of talks and small discussions with people in the Venezuelan government. And then I also went out to schools in Caracas and talked about drug and alcohol abuse prevention. I had a wonderful family I stayed with outside of Caracas, and the capstone of the visit was lunch with the wife of the president of Venezuela, which was a real high point and an enjoyable event. So from start to finish, it was an over 2-year process, meeting the principals from Venezuela, getting invited, having them set up the seminar, and doing the trip. But it was well worth it. It paid off. I made contacts there in Caracas and Maracaibo, people I worked with for years after that initial trip.
Please share with us how you and others used small project grants from partners as stepping stones to obtain rather sizable additional external funding for programs in the Amazonas.
Well, I also began to work with our other partnership in Manaus, Brazil, in Amazonas. And in the early 90s, I was contacted by Dr. Adele Benzaken, who eventually became head of the Amazonas Partners. She wanted to come to Nashville to see our comprehensive care center for people with HIV/AIDS. And at the time, I was working as a medical sociologist doing HIV/AIDS research and prevention activities in Nashville. So we responded as a partnership. We invited her to Nashville. She came, she stayed with myself and my family, and she spent a week at the Comprehensive Care Center and learned about the kind of things that they were doing there, and was looking for treatment and care activities that she could implement in Manaus at the Alfredo de Mata Institute of Infectious Diseases, and that's where she worked at the time. She went back, she took the knowledge she gained and continued to work in AIDS treatment, AIDS prevention, AIDS care there for several years. And one of her activities was to work with sex workers, primarily women, but some men, who came to her clinic. They were many of them had HIV and syphilis, and other diseases. Pardon me. And she was interested in trying to develop targeted prevention programs for these individuals. And in our correspondence, our emails, she said, you know, the CDC probably has some really good materials that we could implement in Manaus targeting sex workers. Could you look into that? Could you work with partners and come down and work with us in developing programs for sex workers in Manaus? So this was a multi-year process. We worked on this for several years, and I was able to obtain a small project grant. I think it was through the Hewlett Foundation, but it was through Partners of America in Washington, D.C. And I got the materials from the Centers for Disease Control, and came down to Manaus, spent 10 days there, and we had people there who, with the support of the small project grant, translated the materials into Portuguese, and we went out to a key brothel in Manaus, and we met with the management, the madam and other people, and we were interested in implementing a condom-only policy in that facility, and we got agreement on that. We publicized our activity there with the assistance of the Partners Small Project Grant, and went to several other facilities. Then I came back to Nashville. We also collected through the Alfredo de Mata Institute, did some interviewing of sex workers with respect to this condom-only policy. And Adele, Dr. Benzaken, implemented this very successfully in Manaus, in several with sex workers and in brothels, and with that information and data that we had gathered, with my assistance, she developed a grant proposal to the Western European Community Fund. And several years later, she received over $40,000 to expand her program targeting sex workers, HIV education for sex workers, condom-only policies for brothels. She implemented that throughout Amazonas and was very, very successful. So she piggybacked the large grant from the Western European Community on our partner's small project fund. Well, years passed, and we continued to collaborate. Not too many years, but we continued to collaborate in the late 90s. And Adele Benzaken had a special commitment to indigenous peoples living in the state of Amazonas. If one goes north from Manaus to the upper Rio Negro area, you have the largest concentration of indigenous people in Brazil. There are about 40,000 indigenous people who live in communities up and down the upper Rio Negro area. And Adele knew some anthropologists at the University of Amazonas who made regular health trips to this region of the upper Rio Negro. And she said, you know, we have discovered in the health clinic in São Gabriel, which was the only site for a complex Brazilian federally supported clinic in the region. She said, we've discovered the first case of HIV there, and we feel this is a very vulnerable population. We need to develop some prevention education materials and other activities that will hopefully stem the tide toward greater HIV infection. She said, could you get another small fund grant and come down, and we'll visit these areas and gather information, develop materials targeting indigenous people, and I will try to get funding from the Brazilian government for expanded dissemination of these materials. And why don't you try to get support from USAID for this, and we'll see what we can do. Well, more years passed, and she did get some assistance from the Brazilian government, and I was able to obtain a grant from USAID, a $200,000 grant for the implementation of HIV prevention education among indigenous peoples in the upper Rio Negro area, over 30 communities. And this grant-funded program ran from 2000 to 2003. And we worked with Dr. Benzaken and the Alfredo de Mata Institute and faculty of the Federal University of Amazonas in carrying out this program, which was very successful. Over these years, Dr. Benzaken sought additional monies from the government of Brazil, and I was very interested in trying to get this program into the 5-year cycle of USAID. So I traveled to Brasilia and apprised the individuals running the USAID HIV/AIDS program in Brasilia for USAID about it. They were very interested in our findings and in our program, but we didn't get into their 5-year grant cycle. However, Adele continued to work, Dr. Benzaken continued to work on getting expanded Brazilian health ministry support for HIV prevention education and ultimately treatment for indigenous people in the upper Rio Negro. And just recently, 2012, she was able to get expanded funding for Amazonas. She had moved on to a post at UNAIDS based in Brasilia, and I think that was very helpful in that respect.
Excellent initiative and project. Talk a little bit more about the current small project that you're developing with the University of Amazonas through the Partners Connect.
Well, through Partners Connect, we have been continuing to work with the University of Amazonas. There's a dynamic professor at the Federal University, and he has an appointment at the State University. And he is very interested in issues having to do with sustainable economic development and successful community adaptation to climate change in the state of Amazonas. And we have been able to, through the partners, they have funded me several years ago to go down to Manaus again and meet with principals at the university who are interested in these topics and lay the groundwork for future work. I, in turn, informed our partners members at the University of Tennessee in Knoxville about what I found there, contacts I made at UFUM and at the Federal Research Institute, and they were interested, very interested in this. And in March of 2012, they sent the Vice Chancellor for Research, a dean, and an economist, a research economist, to Manaus, and though they visited the institutions there, they talked about a variety of activities, including a possible seminar there, and began to process several memoranda of understanding with the University of Tennessee at Knoxville and the respective institutions in Manaus. And since that time, we've had faculty, all of this supported by the University of Tennessee Knoxville, sent faculty down to increase interaction between the institutions, doing research seminars on research writing. A bench scientist has gone down to collaborate at the Research Institute, so more activity. Also, Partners was generous enough to bring up Professor Rivas to the University of Tennessee, Knoxville, last August of 2012. We had meetings with him. He met with various faculty there, and we began to discuss the possibility of doing a project seminar in Manaus on the topics of sustainable agricultural and economic development in the Amazon and community adaptation to climate change. At the University of Tennessee in Knoxville, there were several professors who brought to our attention that the National Science Foundation has large grants to fund seminars and educational programs in these areas of adapting to climate change and sustainable economic development in tropical areas. So from that knowledge, we have decided to revisit our model of trying to have partners support a small activity which will be stage one of another grant which will lead to further education in the areas of sustainable economic development and adaptation to climate change. And we're in the process now of applying for that small grant and also interacting with NSF to let them know that we're moving toward a successful grant proposal with them.
Sounds like some great stuff happening in the future. And what are the take-home points from your discussion for other members of Partners chapters?
Well, my long involvement in Partners has taught me several things about working with the partnership and developing larger projects on smaller grants. First of all, I think it's important to try to select your members with a purpose in mind, a particular project in mind. Select people who have language skills, who have motivation, who have experience to help you realize successful projects. Secondly, participation in Partners is something should be a pleasure for people. You should value being with people from the region in which you're partnered, having them as guests, visiting them. There should be an intrinsic and intangible enjoyment in that, and it's always been that way for me. Partners has always been part of my life. Third or fourth, I would say it's really important to apply for these small project grants with a vision in mind of using them to develop a further, grander project, larger grant. They shouldn't be just a small activity in themselves. They should be step one of a grant application that's going to lead to larger, enduring effects. And with that, you can maximize your partner activity. Well, I think I've run out of time here, but I really appreciate the opportunity to share my experience and ideas with the folks attending the Things That Work seminar out in Greeley, Colorado, and I hope we have an opportunity to meet up and talk at a future time. Thank you.